Hip hinge is another fantastic movement that works in a slightly different way. Most of the time when people are doing the hip hinge, they might actually be very good at a squat, but as soon as they go to hip hinge, it's like the brain just can't compute. And we do see this from time to time and in individuals that can actually squat very, very well with good range of motion. The main error when it comes to the hip hinge is that people aren't able to isolate the hip movement from the lumbar spine movement, which incidentally is vitally important if we're to be able to effectively perform certain stretches of the hip musculature without making the back worse. But also, when you're doing the hip hinge movement, it is reminiscent of bending over the sink, chopping some vegetables, maybe washing your face in the morning or brushing your teeth, or just doing something on a work surface down here. And therefore, the ability to do this movement effectively is vital. And the main mistake that people make is, unlike with the squat, where they tend to round the lower back, they tend to fold forward here at the torso, rounding from the top down, although some still do both at the same time, which is even worse. And therefore, learning to correctly integrate the middle and upper back muscles with the core, with the lower body, and move at the hip and only the hip is a vital skill that needs learning. The secondary benefit is for a lot of people with long-standing lower back issues, not only the back health is poor, but the hip and knee health are poor as well, particularly the knees for this one. And therefore, the hip hinge offers you an avenue to start to build strength and resilience into the back if perhaps the squats just aren't for you with regards to you're limited on the range of motion because of poor knee health, not because of back health. And everybody will get to a point where they start to test some of the other joints. As your back gets really strong, you realize, wait a second, actually my knees aren't as good as I thought they were, and I haven't ever been using them, and now I am using them. I'm realizing actually they're the slowing, limiting factor, not my back. So you might have to hold fire on the squats for a little while and plateau, but you can still use the hip hinge as a mechanism for continuing to scale and improve the strength and resilience in the lower back. And there are a good number of members over the years that have had to take this avenue. That's not to say you stop working on the squat, but it's just that you're going to be limited for a period of time in the terms of the pace with which you can scale the squat, because you've got something else that you need to pay a bit more attention to.